Hi, y'all. Welcome to Cosmopolitans with Lauren. I do not wear the same clothes every single day, but we just stopped one show. We started the other show. We're still here with Dr. Jeffrey Rosenthal, and the show is amazing because my computer is being lit up right now with questions and talks about people aren't, I guess the terminology, they're not understanding a lot of the terminology, like the stringing and what was the other thing
Sure.
that I just wrote down on my thing. I got like four of these questions that they asked me. Endoliths and the microfibers, the PDO threads, um, and what was that? I was in such a hurry, I didn't even get that. But also, they wanted to know if you do non-surgical rejuvenation. I can't say that word. I've never been able.
Rejuvenation.
Yeah,
Rejuvenation.
that's like one of those words since I was a baby. I've never been able to say it. Do you do things such as nose job, boob jobs, liposuction, tummy tucks? Do you do chemical peels? Um, and are you able to work with I have a lot of abuse victims, the domestic abuse victims. Do you work with abuse victims to help them
Mhm.
fix their injuries?
Sure. The last question is for 25 years, I ran around day and night doing emergencies and trauma, and most of it was for free. So I did a lot of pro bono work because my agreement with my patient was if I touch you, you're going to get the best work, and I'm going to do it once, and I'm never going to do it again. And so when you came in, if I did prisoners with ears torn off, and I would do the same work on them as I would do if you were a movie star. I would have mothers come in with their daughters and say, look, my daughter has a big cut. She's going to be a modelist. You know what? If I touch you, everyone gets the same work. It's my name, and you will never get anything less than the best I can do for you. So that's what I've done for many years. In terms of the endolift, it's a unique procedure that comes out of Italy, and it's used all over Europe, but is very rarely used in the United States. And so I brought it to Connecticut a number of years ago, after
Fairfield, Connecticut,
Fairfield,
correct.
Connecticut, after seeing my friend who did it in California, who travels around the world finding these things. And I said, what is that? And he said, this is the best laser I've ever used, and I have 20 lasers. So, what basically it is a fiber. It's a very thin fiber, as thin as a few of your hairs, and it's placed through little pinholes. And the fiber goes under the skin and targets the cells that we want to regenerate your collagen. And by heating it up, it causes it to then regenerate the collagen. It also can actually contour areas of fat along the fold, along the jawline, along the neck. It can actually liquefy localized areas of fat. And think of it sort of shrink wrapping your skin so now it's tighter, and then it's regenerating collagen to make it look better. And that's done in my office. It's done under what's called local anesthetic, meaning I am injecting with a blunt tube under the skin to make it numb. And then I'm using this endolip laser, this fiber, to regenerate your tissue and to make it more vibrant. The collagen stimulation will last up to 2 years. And why is that important? Because after age 30, we are losing between 1% and 1.5% of our collagen per year. So just think at age 50, 20 years, you may lose 20 to 30% of your collagen. So I'm regenerating your collagen, stimulating more collagen, and building up a backlog of collagen. So it's not going to go away as fast. It's going to make your skin look more vibrant, and it's going to take away the fat that you don't want and contour you. So that's number two. PDO threads. PDO threads are threads that are absorbable threads with tiny little projections on them. They're called cogs, and you don't feel them. But these threads are placed again through little pinholes in different angles or vectors that I design in your face. And that's the benefit of having a plastic surgeon, because I know how things go up. I know the muscles. I know how things work. And I'm lifting and supporting your tissues with these threads. And they are then over 6 months, the threads will start to dissolve. Now, why is that important? Because the threads that we used 10, 15 years ago were permanent threads, and they produced all types of complications and infections. And all of those companies went out of business because they just weren't good. The threads that were started in the 2000s were from South Korea. And in fact, most of the threads that we use are from South Korea, where they probably do more cosmetic surgery than anywhere in the world. They have amazing procedures, amazing products. These threads are FDA cleared. That means the factory that makes them have said that they are okay to use in the United States. And so these are the threads that we put in the cheek, in the jawline, in the neck, in the eyebrow. They can be put in the arms and the knees. They can be used in many places to lift and contour. I often will do that in combination with the endolift because I'm tightening the face, but that tightening doesn't start for 6 to 8 weeks. And so
Endo lift being the whole
the
jaw.
laser, that's the laser, the
Oh,
endolift
okay.
laser. And so with that, you will start seeing some fat reduction, but you won't see the tightening for 6 to 8 weeks. So what I'm doing is I'm adding some threads in there to support and hold your face during that period of time. And then it will give you more longevity because I've supported it, and they both will add collagen to your face. So everything I'm doing is to stimulate your tissues to make collagen and make you look well. What was the other question you had?
Well, it's weird.
What procedures did I do now? Or
Well, before you go into that, I'm going to say one thing. It is so weird that you said that because my fiance and my friends get so mad at me. I've been started using about a year ago South Korean products
yes,
because I found them, pure. I like the way the makeup is. I
yes,
like all of it, and I just feel like they're far in advance. They're a little more advanced. They care
they
more
are.
about the skin, whereas here, everybody gets Estee Lauder or whatever. But yeah, I've been using, so I attest to that I use a lot of South Korean makeup and moisturizers and face cleaners. Okay, so you were on to we did the endo lift, the PDO threads. Did we do the endo lift yet?
Yeah, that's the
Okay.
laser, the endolift laser that
Oh,
will tighten and support your face.
do you?
PDO threads, and then I use various fillers. As I mentioned in part one, I use Radius, which is a calcium-based product that's placed along the bone to replenish bone loss, because as we age again, which I've discussed before, but we lose all layers of our face. We lose bone, our muscle shrinks down, we lose the two fat layers in our face, and then our skin elasticity and the collagen is diminished significantly. And so we need to not only replace collagen, make our skin look better, we need to fill the fat layers that are lost with the products that are compatible with our face. And we need to rebuild some of the skeleton so that there's a structural support, like building a house. You build the foundation, put the walls up, put the roof on, then you paint it up. That's exactly what we're going to do with the face. We're going to start from the back and we're going to build it up. So we'll put this calcium-based product along the bone here, along the jaw, and the chin. Actually, it's also amazing for hand rejuvenation, putting this product in the hands. Women who have amazing looking faces and they lift their hands up and they're, wow, that's their
Yeah,
hands.
because they get all their
It's
stuff.
like
That's
they
my
get all
big
these,
thing is
they've lost the fat in their hands, and you can see the tendons and all the blood vessels. And
big
so,
brown scars.
you can put filler in that, and it's painless, absolutely no pain whatsoever. And all you have to do is not squeeze things hard for a few days, and it goes over and regenerates your collagen and hides a lot of the underlying vessels and tendons. So we do that. And then we use hyaluronic acids, which again are found in our joints, in our eyes, in our skin, all over the body that are compatible with the body. And we use that to fill on top. Now, there's a vast array of hyaluronic acids that are out there now. I mean, tons of different ones. And I have to choose which ones are best for each area that I work on. So if I'm going to fill the lips, it's one type. If I'm going to do the cheeks, it's another type. I once saw this woman and her lips looked very weird. And I sort of knew her and I said, what's with your lips? And I touched it. It was like rock hard. I said, wow, who did that to you? It's like, that's not the way it's supposed to be. It's supposed to be
Mhm.
soft, kissable. It's supposed to be,
Mhm.
you're supposed to feel good.
Feminine.
It's not supposed to be rock hard, just like in the other products in your face. They're placed in different layers, so they're not lumpy or bumpy. And when I place them, I'm actually contouring them with my hand. I'm sculpting it. So when you're in my office, I'm just not throwing a product in you. I'm drawing a map where I want to do it. I'm injecting little bits, sitting you up. I'm molding you, lying you down, putting it. You get a belly workout, abdominal workout with me because you're sitting up, lying down, sitting up, lying down. And when
But
I'm finished, you get both.
but do you do breast surgery and
Right.
uh
So for over 20 years, I was doing the entire cosmetic of the body.
yeah.
And I was doing a lot of breast surgery, both reductions and augmentations. And actually, I did a lot of 16, 17-year-old girls that had mammoth breasts that did sports and they had shoulder pain, back pain, breast pain. And they would come with the mothers and they said, look, my daughter can't function this way. I would send them to a child psychologist first to explain, look, you're going to have scars and you might not be able to breastfeed. And invariably, every single one that I did, when they would sit up in the hospital the next day, they would say, my back pain's gone, my shoulder's gone. I feel so much lighter. And the women whose husbands would say, don't do it, I'd say to them, take 10 pounds of sugar, put it on each side, and wear it around your neck for 2 weeks. Let me know how you
Mhm.
feel. So I did that. Tummy tucks, I did a lot of those, especially after pregnancies, when things didn't shrink down, your muscles were loose. So I've sort of migrated away from those things, and
Mhm.
now I sort of focus from the neck up. And why do I do that? It's visible. I'm an artist. I'm very visible. I like to sculpt, draw, paint. And as I mentioned before, I've had art shows around the world. And so when I work on the face, I love sculpting faces and necks and noses and eyes and making them look natural. Noses are one of the more difficult procedures to actually do because you're working through two little nostrils upside down and backwards. You're taking tiny slivers of cartilage away to sculpt the nose and to make it look like your face. Years ago, I had a gentleman come in, very nice man. He was very short and wide, big face. And he said, I'm a Johnny Depp impersonator. And his nose was like this big. And he said, I want a Johnny Depp nose. Just, even if I could do that, it wouldn't look good on your face. You have a really big face. And he said, okay, now do it. And finally, I said, look, it's just not optimal for you. I can only do something that makes you look natural. I'm not going to do it that makes you look fake. So
Change
I
your
do,
look.
I do facelifts. I do a lot of eyelids. Again, they're my techniques to make them look natural. My scars stay within the groove. They don't extend out here. Same thing under the eyes. You want to keep the scar very high up and short and sculpt just the right amount of fat, not make it look sunken. And obviously noses that we've discussed to make them look natural, fit your face. It's got to blend in with your face, and that's a beautiful face. If everything blends naturally and harmoniously, that's what makes someone attractive.
Um, what about, do you have a certain, do you carry a line? I know I used to have when I first started my show, I worked with a dermatologist. They were actually a sponsor on my show, and we would go in there and test all the different products that they had. So, do you carry your own line of products, or do you just recommend products?
I recommend products. It's very easy to carry your own line of products. You just call up the company and say, put my name on it.
Yeah,
And you're selling them for more money. I don't
right.
believe in that.
Yeah.
So I will recommend, even if I don't carry the products in my office, I will say, you know what? I was lecturing in Las Vegas a month ago, and they had a big display of all these products, and all my friends they know about all these things, and we would discuss which are the best products, what are you using now? And even if I don't have it in my office, I will say, you know what? This is where you get it. This is optimal for you. Or I'll say, go to my friend and they can get it for you,
Mhm.
which is best. So, but you don't need a lot of products. You just need some basic ones that really work well, and you don't have to overdo yourself with products that burn your skin or cost you a fortune. They shouldn't cost you a fortune.
No,
Who's going to do 15, 20 minutes of products every morning and every
no.
evening? You want something that's simple and
Right.
fast. You want to clean your face. You want to put moisture cream on it. You want to put serums that will regenerate it. One of the products that I use are snail products,
That's from my South Korea.
yeah. Well, this is not from South Korea, but it works in the same similar way. Stem cells, from snails, and it does help the skin. In fact, one of the products after I shave, it's a little moisturizer of that, and I put it on my skin every day, and my skin feels so great right after I shave,
Mhm,
just by putting that serum on my face. So you
mhm.
don't need a ton of products. You need good products. If you look at how the French dress, they have a few nice outfits, but then they add a scarf to it, or they add something else, and it always looks chic and great. It's just like products. You don't need like 30 products. You just need a handful that you're going to use and that actually do something for your skin. That's ideal.
But don't you feel as far as because I used to my shows when I first originally started was really a lot of beauty, fitness, and style, and so
Mm.
that was basically centered around that. And I always recommended that you should change up once in a while. I mean, you shouldn't be
Sure.
using the same product that you've been using for 5 years. It's a good idea to change it up so your skin gets a little bit of change up and you're just not using the same thing. I always recommend
I agree.
change up shampoos, you
Yes.
know, this, that, and the other.
Well, not only that, but you have different seasons, and the skin is going to be drier. It's going to be, moisture in certain seasons, and so you have to change your products to fit not only your skin at that point, but also what's happening in the seasons. If you're drier, you need something that's more emollient, something that's going to give you more moisturizing in your skin, not drying it out as much. And the type of makeup you use is also critical. You want to make something that's not going to dry out your skin, clog up your pores, something that you can take off easily and looks refreshed, not like a mask. You don't want to look like a clown. Some women wear way too much makeup. You want to emphasize the cheek structure so that reflects light. You want to create a little darkness under the cheek that captures light. You want to improve the jawline a little bit. You want to blend things in and not make it look overdone. And so
And people
that's
laugh and they meet me because they're like, you're Lauren, because I just don't wear makeup. Well, I mean, I used to, because I used to be working full time with two kids and four different jobs. But now, like, I just wash my face, maybe put some eyeliner on, I mean,
sure.
eyebrows and some lipstick, and then I'm ready to go because that's how it is in Cape May. Now, women that I know that go to work, I feel that's one reason I've been working on these little makeup line that I'm doing is that as you get older, you don't need as much, you can't wear as much makeup
Right.
as these young 20-year-olds that, can pile it on it. They can carry it off, but you can't carry off shiny eyeshadow when you're 50 and 60 years old because you look like you
Right.
know, it's all in the lines and whatever. So, I don't know why I just inserted that in there. It's just like I think it's important to know when is the right time to back off on your makeup. And of course, when I go out or when I'm doing the show, I know what y'all are going to say. I know before y'all send me any message, I know I have a lot of makeup on for the show, but that's for a show. Um, but you do have to find your kind of in between.
Yes.
I used to wear a lot when I was I guess after my fiance died and I started dating, I would come right from the shows onto a date. And I remember one of the guys just looked at me, he goes, "Do you have false eyelashes on?" And I was like, "No." It's just because I just was working and I came from work, Birmingham, Alabama, nobody really wears false eyelashes. But you have to
They don't wear false eyelash in Alabama.
not
Really?
really. I mean, I haven't been there so long, they may, but I can tell you, my girlfriends don't wear makeup. I mean, all my friends are athletes there, or they don't care what they look at. They've got other important things to do. My daughter wears no makeup. She doesn't need to. She's gorgeous. Um, but yeah, you have to find. So I guess my thing is what you're saying is that you have to find that technique where you I guess get comfortable with my fiance gets mad at me all the time because I'm like, I haven't had Botox in 2 years. And he's like, where you gonna put it? And I was like, I want to put it, I want to put it right here. And I want to put it right here. I don't want a whole face done. I just feel like I need a little bit right here. And men don't get it. They're just like, oh, I don't.
Well, you know what? I have many patients, and the women will come in and they'll say, I'm going to pay you in cash. I say, I don't care how you pay. Check my. They say, no, you don't understand. My husband can't know I'm doing something. But invariably, the next week they will say, honey, you look so beautiful. And I'm saying, what kind of guy is this? Wouldn't they want you to be happy? They're making you happy. So
Mhm.
what's the difference? It's just, if it's not overdone, and it shouldn't be, when I do Botox or Xeomin, I actually do micro injections of it. I don't like paralyzing. I balance brows. Often one brow is lower than the other and one eye is a little lower. And so by putting it selectively in the brow muscle that's pulling it down, I can lift
Mhm.
it up. And by doing micro injections, it shrinks down the oil glands so your forehead looks smoother, and yet
Mhm.
you have some animation. So I can
Mhm.
make these two big muscles that are called the corrugators that are very powerful from frowning a lot. I can diminish that. I can balance the eyebrows, and I can make your forehead look smoother and take away some of the deeper lines here. The lines that you get in the crows, if you have them etched in your skin and you're not wrinkling, I can't get rid of those. I can get
Mhm.
rid of the active ones that when you wrinkle like that, I can soften those. Now,
Mhm.
some patients will come in and say, I don't like these lines down here, but they don't understand these lines are coming from your mouth muscle. That's
Mhm.
important. And if I paralyze that muscle, when you get a smile, you're not going to smile. And so you have to understand anatomy. And my object is to balance the brows, make the forehead look smoother, but not paralyze you. And I remember a story that was told to me. It was a soap opera, and these two women were on the soap opera, and the director said, "Okay, look angry." And he said, "No, no, look angry." He said, "Can't you look angry?" He said, "What's wrong with you two?" Somehow we just had Botox. So you're supposed
That's
to animate to some degree. You're not supposed to look like a mask.
mm-mm.
And we can now use Xeomin or Botox to lift the corners of the mouth. We can
Mhm.
put it in this area to actually make the jawline nicer. We can put it in the chin where you get that, it's called peau d'orange, this little, it looks like orange skin, and we can correct that. We can
Yeah.
put it in these band neck muscles to shrink them down. So we,
Venus muscle. As an artist, you know that. As an artist, like the Romans, they would consider the Venus rings beautiful. Now we're like, it's
well,
there.
it's not only the rings, but these bands, which are the ends of the muscle. This is a
Oh yeah,
platysma muscle. So
I've
the
had those in.
platysma muscle goes, it's a muscle that goes on both sides, and it's actually separated in the middle. And as we age, it comes down and apart. And so you're seeing the muscle bands, and we can put Xeomin or Botox, it's called neuromodulators, in that will actually shrink down that muscle and make it look better. This is used again in South Korea often, where the Koreans have big bulges of their muscle here, and they inject this. It's called the masseter muscle, and it's the muscle used for chewing. But they can shrink down the lower portion of it so there's more of an indentation. Now, I have a problem with doctors taking out what's called buccal fat pad. That's right over here. Because as you age, if I've taken out this fat when you're 30, which you shouldn't do ever, but let's say 40 or 50, when you're 60 or 70, you're going to be sunken like that because I've taken the fat out. And so you don't want that. You need that fat. So if this is a little bulgy, make your cheekbones a little bit better.
Mhm.
Contour the face. Don't take out the fat. You need fat. We lose fat. It's precious in our
Mhm.
face. And it
So
doesn't come.
do you do the thing where they people take fat from other places and put it in their face?
So I do that when I'm doing a facelift, and I've done that for burn patients, but it's not, you can't mold and inject it well.
Yeah.
And so the products that I use now are I can inject them and sculpt them with a blunt cannula or needle, and I can build up areas of the face where if you're putting fat, it can be lumpy. Also, you lose about 20 to 40% of the fat that's put in your face. And so
Hmm.
you have to redo it, and it becomes more expensive that way. But I can get a much better contouring and a natural look by doing different layers of fillers that will
Hmm.
replace bone loss and skin sagging by
Hmm.
doing very different fillers. And again, I have a whole array of fillers in my operating room here that I choose from depending upon what I'm trying to do. So I don't do fat now unless I'm doing a facelift.
And it is, I think, important. I know me when I was modeling, I really had a really thin face with a long chin and stuff. Um, and you just have to, for women, we want to look like, I think women want to have the Angelina Jolie lips, so that's why we got it all big,
Mhm.
or we want to have people take pictures of, I forgot who, Charlize Theron's eyes and stuff, and they take it in there and they want to look like that. And I think that that women, and as a patient, I think it's up to you to kind of research what you're going to do and realize that, I don't look anything like Charlize Theron. My eyes are
Don't.
not going to look like that, and my lips were not made like that for my face. And just to just to be accepting of yourself. I mean, I did a whole series on learning to accept the new me, because as a triathlete and someone that was in bed for 2 years learning how to walk and talk
Mhm.
and trying to move around again, I don't like the new me. I guess I'm having to work up to be an athlete again, and I don't like the way I look. I don't like that. But it is trying to learn to love yourself, the way you are, and you can make changes, but don't expect you can go into your doctor and say, okay, make me look like Angelina Jolie. And if he doesn't, then you're like, okay, well, it didn't work for me. I got to go somewhere else. You've got to learn to love yourself, right? And I would
Well,
think,
yes. So here's the thing: we get issued one body. That's it. You get one, and you have to make do with what that body is, and it's going to age. And you have to accept the fact that you're going to age gracefully, and we can keep for each age making you look well and refreshed and rejuvenated. But if you bring a picture of someone that's a movie star and you say, I want to look like this, I can't do that. Or if you bring a picture of yourself when you're 20, when your bone was fuller and your fat was fuller and in fact, the contour wasn't even there, I'm not going to do that on you. And so I have to take what features I see now and then discern what is optimal for your face to make you look refreshed and well. And that's the benefit of being a plastic surgeon. I can choose from surgery to fillers to threads to endolift. I can do whatever I want, and I have the facility to do all of those and the knowledge as an artist to look at your face and discern minute little details. And that's really what differentiates me. And that's why patients come to me. They know I'm an artist and I will never rush. And then I can choose from a whole array of things to balance them and make them look natural. But you do have to accept yourself. And there's something called body dysmorphic syndrome, which means that you never really accept what you look like. And you always think you're too skinny or too fat or too this or too that. And that is a psychological dilemma for these patients. I've had a few of those patients, and
well,
I've
a lot
said,
of time I think it's with athletes and well, as an athlete, because our trainers were so hard on us.
yes, they
You have
are.
to run the tennis court till you drop 10 pounds by the end of
Right.
practice, or people that model and stuff. But I think it's as you get older, you learn to, I've always felt like it's what you can give other people. And I guess I'm sitting here looking at something somebody wrote, is writing me. And I think it's important that if you go to a doctor and they're saying, I want to look like that, and you're like saying, I can't do this, they don't get huffy and puffy and then go find a doctor that's going to do
Right.
that, because they're most likely not going to get the results that they want. And I think that's when you develop. I mean, they said that's what happened to Michael Jackson, is he wanted to look like this and it wasn't going to work for him. So he
Right.
did this, and then it still didn't work. So he just kept moving forward, trying to think this person's going to change it. This is going to change it. This is going to change it. And you've got to really find a legitimate plastic surgeon such as yourself that will give you the honest truth. I can do this
Yes.
and I could do this, but you're not going to look right. And
Well,
we all have flaws. I mean, like,
no, I agree, and that's one of the things my patients repeatedly say to me. You're so honest. I will say, no, you don't need something. No, that's you're done. Or if someone is coming to me and they're unrealistic, I'll say, look, you really don't need this. I can't make you better than this. Yeah, you might go to four other doctors and they're going to convince you to do this, but it's not the right thing to do. You look really well. You don't need anything else. You're attractive. Go out and buy yourself a new dress or have some skincare treatments. You don't need anything. And if they do need something, I will then say, okay, what do you want? What bothers you? And let's come up with a plan that makes you look better for each stage. that it's not a one time, it's gradual. We're going to fill you, we're going to do this, we're going to change as we go along. But
Okay, I
it's
just got hate mail from one of my men.
oh
Said y'all are only talking about women. Men may need help too.
yes,
What
they do.
what do you do for men that you be same equivalent to women? And also, what about men that are losing hair? Can we do anything about that?
Well, nowadays, some of the serums that are out there to affect hair growth are pretty amazing. That they are, I don't do hair growth,
Mhm.
but a lot of my friends will. And there are serums that they can actually inject into the scalp itself and see hair growth for men and for women. Excuse me, the gentleman.
No, I lost all my hair, so
It works for both. But my practice probably is about 96% female, and then a combination of 4% men. And they also lose bone mass, where you have to fill the jaw often and you have to fill their faces. And the serums that I use, that I was alluding to in the first part, which are the serums that regenerate your collagen with a mesotherapy procedure that's very innocuous. You're pink for an hour or two. The men, I do love it. It's done once a month for 4 treatments, and then they come in every 6 months. I have one or two men who will say, "Can I do this every month? I love it. My skin looks amazing after." I said, "Sure, it's not going to hurt you." So we have the same fillers, but again, when we look at the aesthetics and the balance of a male face, it's very, very different than from a female face, and that's what we have to consider.
do you put do you put clefts in chin for men?
No, I don't do that.
Okay, you don't get a cleft. You know, whoever you're
I'm
asking,
sorry.
you
I
know.
don't. I only do what I believe in. I don't do
Okay.
something that I don't believe in.
All right. You had mentioned the glow facials, which I know is a big red carpet glow
Yes,
facial.
it is.
Do you do those
Yes.
in the office? So you do facials as well as other things.
Well, I do these serums that are actually better than some of the facials because they're not only gently removing the outer dead layer, but they're having these serums, which is the PDRN, which is the salmon DNA, and other products that have come out to stimulate collagen and to directly affect the fibroblasts which make collagen. I do a lot of those in the office, and again, you come in, it takes me an hour, 45 minutes. We clean all your makeup. Preferably, I actually don't come with makeup or any makeup, sunblock, anything on your face. Because when I'm using this procedure, it's driving the serums through micro holes in your skin, not big holes, but you can't even see them. And the serums then will penetrate in. So if you have makeup on or sunblock, it will penetrate. So even after you've washed your face, I will wash it again 2 or 3 times. So I
Mhm.
do that in the office, and those are the treatments that we usually use here, in addition to the product lines that we carry.
So would you encourage your what would be what is that? What is would you be your morning routine? I would think wash your face, tone it, put moisturizer on,
Yeah,
sunscreen,
that's it.
and your
That's
night
it.
and your night routine. What is the difference between the two?
Well, you might add some sea serums at night. You might add a retinol at night every 3 or 4 days. You might add something that's going to remove some of the outer dead layer of your skin gently. You might put that on at night. Not necessarily during the day. Again, you want a good cleanser that doesn't rip your skin apart. That's very gentle. A good moisture cream, a sunblock, and then most women wear makeup. And so,
Mhm.
those are the things that you would do during the day, and you need to take your makeup off and then go through most of the regimen at night. It should take you only about a few minutes to do.
Yeah, I hate this
Really,
one. Like
it
I have
shouldn't.
30-minute deal. I got it.
Yeah,
Yeah, right.
no, it shouldn't do that. This should be, and men too. You know,
Mhm.
alluding to what that gentleman who was angry by not speaking about men. Well,
Uh-huh,
we should do the same thing. We need to
uh-huh,
cleanse our face with a mild cleanser. We need to tone it. We need to use a good moisture cream, especially after shaving. We
mhm,
need to use sunblock. I mean, all
mhm,
these things are apropos of men as well to have good, healthy skin. You want good skin, you got to work at it. It's not so, it
mhm.
shouldn't take you a long time. I mean,
Uh-huh.
literally, it takes me 2 minutes. I shave and do my other things. It's not a big deal.
Now, what do you Do you believe in chemical peels?
The chemical peels, they do burn off the outer layer of your skin, but I think more gentle ones with different
Like I
products,
do it, I do one at home, like a really light
very,
one.
very gentle ones, I think
Yeah.
are okay. But deep chemical peels, there are some peels for women that have the etched wrinkles, like it's called geographic, that cross hatchings in their skin. And the only way you can get rid of that is with a deep peel. But often that will also remove some of your pigment. And it also may prevent you from sitting in the sun. But the trade-off is probably worth it to have that. But that's appropriate for very few people nowadays. Now with all the products that we have that are gentler, and the sea serums and all these, and the mesotherapy that's removing the outer dead layer, I don't really think you need that. Even microneedling now is with radio frequency that will help and regenerate your tissue. And so mild peels, fine. Frequent mild peels, I don't believe in that. And deep peels, very infrequently, if ever.
Right. My nightmare story that I'm going to share with everyone is when I was pregnant, I developed a pregnancy mask
Mm.
where I was really dark pigmented here.
Melasma, that's
Hmm. And I went to, this is why I say that you should always do your research on plastic surgeons. So I went, no, he wasn't even a plastic surgeon, he was a dermatologist. And I went in there with my baby, and he was like, oh, I can fix that in a minute. You just need
wow.
a chemical peel. And I got a high pain threshold. He put the chemical peel on. It hurt so bad I ended up throwing up. I was just
Mm.
miserable. Did not tell me anything about it. Okay. He said it'll, your skin's gonna slough off, and in about 2 weeks you'll be okay. I was like, okay. So I took my kid to the train station and let him watch the trains, and all these people are looking at me. My face had turned black.
Ooh.
It actually looked like I had burned my whole face. People were looking at me for almost a month. I couldn't go out of the house. Maybe that's why I have good skin. I don't know. Maybe it just went down to the bone. But nobody explained anything. Nobody said anything. Not even that he didn't come in afterwards. And that is when I told you I quit laying out. I quit doing everything because I was like, you really have to be informed when you go
Yes.
somewhere to know.
Yes.
Even you're going to get a pap smear, you need to know it's your doctor you're doing, what, this, that, and the other. I feel like it's important. And I'm sure that doctors appreciate it. I was married to a doctor who was a dick. Um, and I say that openly, but I do feel like it's important. It's up to the patient to have your questions down,
Yes.
so you're not having these expectations so that they can't do what you want, and then they go out into the world and they start, well, I hate so and so, they did this crappy and this crap. And it's because you didn't ask the right questions, or
Right.
you set your expectations too high. And you do you have some of that, like you do somebody's face and you're like, baby, you are rocking, and then they call you 2 weeks later, I don't feel like this is what I really wanted. Do you have those whiny, complainy people, or are you picking your patients?
So here's the key is selection of my patients.
Mhm.
And they're selected by my staff. When they call up, they let me know about them. They come in here. If they've had other surgery, if they want me to do repeat surgery on them, I don't do that. If you've had fillers, you want me to treat a filler that's lumpy, I don't do that. My complication rate is almost zero because I spend so much time with everyone. Even when I do surgery, I've had to treat two patients after major surgeries because they had high blood pressure, and it
Mhm.
wasn't even anything I did. They ended up with high blood pressure problems.
Mhm.
So I spend so much time, I don't want to treat anyone else. But the key in my office is that I spend over an hour in a consultation, and it's with me. You're not seeing anyone else. You're not seeing a nurse. You're not seeing a secretary answer your questions. You're seeing me. And when I finish with that consultation, I've answered all of your questions that you will ask. You don't have to ask me because I'm treating you as if I was sitting on the other end over there, and I'm going to give you all the answers before you even have to ask me. When you leave, I said, do you have any other questions? I said, no, you've told us everything. And, I learned that when I started my practice, I went to an accountant. And after the first year, he said, okay, you need this, this, and this. I said, well, why don't you tell me that? I said, you got to tell me what I need. Second year, he did the same thing. I said, look, that's not how I work. You tell me what you need, I'm going to give it to you. And
You're
that's
the professional. Yeah.
and that's how you're the professional. I'm not an accountant. I don't do numbers. I don't do them well. What I do well, I do exceedingly well. What I don't do well, you're going to do it. Patient
Hmm.
comes to me, I'm going to tell you everything you need to know. I'm going to tell you the benefits. I'm going to tell you the risks. I'm going to tell you the longevity. I'm going to tell you the fees. I'm going to tell you exactly what you're going to feel, how it's going to look, the healing phase, what you're going to do, all of it. And when you're finished, when patients come into my office, my staff says, well, they're a little nervous because first time. When they walk out, they say, what'd you do? They're so relaxed. Look how calm they are. I said, because I've addressed them, all the issues, and I've treated them like a human being. I've not just treated their face, I've discussed nutrition with them. I've discussed vitamins. I've discussed what they're going to do before and after, exercise, everything that's going to go into the optimal healing of your face. Because if I leave something out and they do something that ruins it, they're not going to be happy and I'm not going to be happy. So I'm going to give them all the information, both verbally and in writing. And I'm going to review it again with them. And so they're comfortable with, and we're going to call them up and say, in a few days, how you doing? We're going to call them up in a few more days. Any problems? Any questions? It's swollen? That's normal. It's all good. It's going to go down. It's going to look really nice. That's
Okay. I got somebody right here that's saying, do you believe in the face yoga that people do online?
I don't.
You don't.
I do believe in moving your face just for bone movement, your jaw, especially if you have TMJ problems, switching it. There's muscles over here you can massage. I think it's good to move, but remember, most of the muscles are attached to the skin. So they go from bone through all the tissues into the skin. It's not bone to bone. So you can get a big bicep because it's bone to bone. You can work on that. It's getting bigger. But if you're trying to get your muscles in your face bigger, it's not going to work that way because the muscles aren't attached. In fact, the lip muscles aren't attached to the bone at all. They're attached to the other muscles. And so, the more you pucker and the more you make a face, the more lines you're going to get. So gentle movement is for blood flow. I think that's fine. Doing blood flow, perfectly fine. Doing it excessively because you think it's going to strengthen the muscles of your face or neck doesn't work. It's not.
Doesn't work. All right. Don't get mad at me. I'm just going with a question here. I'm just going to read it directly. Lauren, are you going to get prices from him? Or are you going to leave us hanging?
We're going to leave you hanging.
I'm
And the
leaving
reason,
you
well,
hanging.
there's a reason for that.
Okay.
Because so when I will do sometimes Zoom calls from, I had a woman in Georgia and a woman in Michigan, other parts of the country, and they can't always come in right away. And I want to discern whether they need the procedure. And I will look at them and I say, look, I need to feel your skin. I need to see the movement of it. I need to see the
Mhm,
scarring of it. And I need to see a three-dimensional view, not something on a Zoom call. So
mhm,
I said, I will give you a range, but when you get here, I will be very specific. And that when I give you a fee when you're here, it doesn't change. When I do
mhm,
surgery, and if I'm doing a nose and it takes me longer, then my noses take 3 hours because
mhm.
it's very meticulous to do. And
Thank
I'm
God I got a good nose.
so, but I tell the spouse, I said, look, if I'm in there 3.5, don't worry. I'm taking my time and I don't charge you for it. It's what I
Mhm,
do. Same
mhm,
thing in my office. If I'm doing threads and a lift, I give you a fee. And I say, wow, there's a lot of scar tissue. I have to do more. That's the fee. I'm not charging.
mhm,
I'm going to do it until I'm pleased. And if it takes me longer, it takes me longer. When I do office procedures in the afternoon, basically it's one patient. I'm not going to rush. If it's a 3-hour procedure, I'm not going to do you faster. And I don't keep my patients waiting in the waiting room. I spend a lot of time in between because their time is as valuable or more
yeah.
valuable than mine.
I
So I don't do
appreciate
that.
that.
And I never rush through anyone. And they know that. The few times that I've kept them waiting, we not only call them and say, look, I'm late because it's taking longer for this patient. Or if they do show up, I say, look, I apologize. I'm going to take as much time with you as necessary. I never rush. And
Gosh.
so to give you fees is very difficult because there's ranges for everything I do. I mean,
Right.
if someone comes in, they say, I want fillers. Well, you may think you need one syringe of a filler, and I may look at you and say, you need three.
Mhm.
Or
Okay.
Botox or Zeman, which is the same neuromodulator. They may say, well, just do this area. So, well, the muscles in the forehead are in a tug of war. And unless I balance the ones pulling and lowering, I can't make it look nice and relaxed. I don't want to paralyze you, but I have to balance it. And so they may say, well, just do that. So, it's a waste of money. Don't do it.
Okay.
So to
All
get
right.
these is difficult.
Okay. Now tell us where you're located because like, actually we've almost gone through the whole other hour. So
Uh,
tell us where you're located, how you make an appointment, et cetera, et cetera.
we're having such a good time. It's just time
I know. It's like, oh my God. And I was looking at
was
my
like
phone.
flying by.
My phone's like, I was like, it's 20%. What? I was like, okay. So
So
where
I'm in Fairfield, Connecticut,
mhm,
which is the southern part of Connecticut. It's by train, it's an hour and 15 minutes from Manhattan. We have airports around here, so and a train comes up to me, stops in my town. And it's a 5-minute walk to my office. So it's or an Uber from different areas. So patients come from all over.
mhm.
My phone number is 203-335-3223. My website has tons of information. It's Jeffrey Rosenthal, MD, one word.com. Uh,
Okay, well, people don't get too bogged down on that because I listed all that
yeah,
out for y'all.
so that's the way to, you will call out my office. You'll tell us what you're looking for. And then if you're in a faraway place, we will say, okay, let's have a Zoom conference. It's not ideal if you can't come in.
Hmm.
Tomorrow, I'm having a woman come in just for the conference, and she's driving back 3 hours
Hmm.
because she don't want to do Zoom, which is a long trip, but she will get
Worth it.
she'll be better because I will then really tell her what I can do by touching her skin and feeling it, as opposed to just looking at you in a Zoom call. It's funny. Years ago, I'll tell you a quick story. A woman came to me for a facelift, and she said, and I put gloves on and very proper,
Hmm.
feeling her face, and she said, "You're touching my face." And I said, "Yeah, I'm touching your face."
Yeah.
And she said, no, you don't understand. I went to a plastic surgeon. He sat in his desk. He just stared at me the whole time, didn't touch me, didn't do a thing, gave me an outrageous fee. I said, really? He didn't touch your face? How's that even possible? So you have to be ethical, moral, and do the right things. And it's a business. We have to make money, but I don't gouge people. I give them the worth that I try to give everyone, every single person.
Okay, here's one last question, and then I have a question.
Sure.
One last question is that Lauren, can you go to the clinic and let us watch what he is talking about? I don't think that they're understand, and it's hard. I guess it is hard to visualize the threading and all that
Yes.
other stuff.
Well, I do have videos on YouTube that show some of the procedures I do. I do have things on my Instagram at Jeffrey Rosenthal.
Okay.
It also will show some of the procedures, some before and after, so you can see them. So the combination of my YouTube, Jeffrey Rosenthal MD, my Instagram, my Facebook, and also on my website, there are videos that I posted on my website that really shows some of the procedures that I'm doing that we talked about, threads, endolift, some fillers. So it shows me actually doing them.
All right. I so people
But you're more than welcome to come here and watch me do something. That's fine.
something maybe I'll need some work. Okay. All right. So I'm finishing off with that, but I do want I am going to contact you later because I'm interested in your artwork and I'm interested in your children book
Yes.
because I've done both of that stuff. So I'm interested in that. So we
And
will
my
contact
poetry. I
and your
love my
poetry.
poetry.
Oh my God, if you could read my daughter's poetry. I mean, she's like Edgar Allan Poe,
Oh, well, that's
she's won all these awards, and I keep telling her, Julia, just put them in a thingy and I can get them published. I mean, it's just, but you know what? I'm a screenplay writer too. I know y'all know. I've written a couple of movies and stuff. Um, but you have to be for me and my daughter, you have to be in a really dark place to write because that's the way I write. I can't write when I'm like,
right.
I really need to feel that depth to do what I do, which, that's why I want to talk to you is because different writers and different artists do it different ways. So that'll be a whole different show. But we want to thank you, Dr. Rosenthal, for coming on the show. It's been so exciting. I've learned so much stuff. I definitely will be back in touch with you. And you can look forward. I probably will get these all I get one of the shows posted up by tomorrow, because I probably will not get it sent back to me until tonight to go run through and look at it. But we are on Armed Radio with Lauren Damage at Cosmopolitans with Lauren, and we are with Dr. Jeffrey Rosenthal, and we really appreciate you being on the show. We've learned so much, and I really, really appreciate it. And look forward for me sending you a message soon, okay?
Thank you. It's my pleasure. And, maybe we'll do a live call in one of these days and I can answer them directly.
Yes, yes. I'm getting to that point. I used to do that all the time, but I don't really have a set such a we don't I don't have a studio. When I had a
Mhm.
studio in New York, it was like that, but I'm working out of my house.
Right.
Um, so I'm still working on getting back to the where I was. But we'll get to that, okay?
Well,
So
you look great. And
thank you.
it's admirable where you've come from. It really
Thank
is.
Thank you. And I look forward to seeing you soon and talking to you later. Okay. Have a great night and join us again, y'all, on Cosmopolitans with Lauren. And I will be listing it all up tonight. All right. Bye now.
Bye.
Bye. Okay. Stop recording. Stop recording.